Hi everyone. In a recent video, I said I had told you almost everything about the penis. I thought there was not much left to tell you, but every day I learn something new. The topic I will cover today is a quite rare occurrence, so I thought it wasn't crucial, but a patient had a long-lasting issue, and therefore we studied this problem extensively and learned new things. Since it is an interesting subject, I decided to cover it in a separate video. Urinary incontinence following a penile enhancement procedure. So far, I have heard 7 or 8 patients complain about this. These patients said that after the surgery, they had incontinence for a short time, like a week or maybe 10 days, and then it disappeared. They referred to this problem in 2 ways. First, a patient may complain that urine leaks involuntarily when he coughs or when he suddenly gets up from his seat. In other patients, some drops of urine may leak into the underwear after urinating. I think the reasons for these two are different. Excessive urine leakage after urinating is probably linked to the enlargement of the penis. In this case, I think that urine accumulated in the urethra drips because the penis is larger, looks as if it were erect, and the urethra is much longer. This is not a major problem. It will disappear soon. The real problem here is urinary incontinence due to a sudden movement, when the patient gets up suddenly, coughs or laughs maybe. This is really annoying. I've heard of this problem from around maybe 8 patients. I know that it disappears in a week, but it lasted much longer in one specific patient. It lasted 1.5 or 2 months. So I decided to investigate the underlying cause of this issue. First of all, the patient suffering from this problem was very young. The issue is he was experiencing quite intense stress in his life. He was preparing for an important exam. He also had plenty of stress factors related to his job and his family. So in his life, he had multiple different stress factors. Then he underwent surgery and started complaining about urinary incontinence. He told me that he had incontinence when he drank a lot of water, when he got up suddenly, when he coughed. I couldn't figure out the reason at the beginning. The penile enhancement procedure, the depth of intervention during surgery, cannot really be related to urinary incontinence. There is no logical reason for urinary incontinence to be associated with the surgery. So I decided to investigate this issue and consulted some urology professors because urinary incontinence is a topic concerning urology. So we CT scanned these patients. We applied some tests like urine flow test, bladder pressure test, etc. And finally, I have found out the reason for this matter. It was really interesting. First of all, this has nothing to do with any technique applied during surgery or procedures performed during the surgery. The most interesting result from tests was very high bladder pressure. The conclusion we reached as a result of our discussion with the professors is as follows. In some patients, stress triggers an increase in bladder pressure. The stress that the patient is exposed to in his life contracts the bladder and the patient becomes ready to urinate. In other words, urine leakage occurs at the slightest movement due to contraction. So, some psychological problems and ailments may appear differently in everyone in a different manner. Take the simplest. Stress causes stomach ulcer in many patients. If the patient has a problem, if he is stressed, too much acid is secreted in the stomach, causing stomach ulcer. In some people, it affects the intestines. For example, the patient suffers from constipation. In other patients, the intestines begin to work too much and cause diarrhea. In still other patients, stress causes contraction of the bladder, ending in urinary incontinence. It is literally the same thing with the urinary incontinence when one gets very terrified. When the bladder contracts during a shock or during extreme fear, the patient leaks urine due to adrenaline discharge. You know, people say, "It scared the piss out of me." It's exactly the same thing. If the patient who has undergone penile augmentation experiences much stress in his life, even surgery itself can cause the stress, by the way, excessive contraction of the bladder manifests itself as urinary incontinence. This has nothing to do with any surgical technique. The mechanisms for holding urine in the bladder are located before and after the prostate. The prostate is deep down, such that the prostate is examined through the anus. It is in the pelvis. So you can feel the prostate only via the anus. If you want to touch the prostate, that is, feel the consistency of the prostate, you have to examine by inserting your finger through the anus. You cannot feel it from the front. The depth of our intervention during penile enhancement procedure is very shallow. We can't reach the back. We never go into the pelvis. Therefore, it has nothing to do with surgical technique. It's entirely about stress, maybe because of the surgery or because of other factors. So, if the patient suffers from urinary incontinence, that's how I think. The cure is as follows. First, prescribe something to relieve stress. Antidepressants or maybe some other sedative herbal syrup. Sometimes I even think whether I should directly prescribe a sedative after surgery to these patients. Because you cannot know in whom such a situation will arise. I have not encountered it in many patients, but it's really annoying. Maybe it is necessary to calm down the patient a little after the operation. For example, we used to prescribe passiflora syrup to patients after hair transplantation. We don't want the patient to experience stress after hair transplantation because stress prevents the attachment of the transplanted hair follicles. The hair follicles transplanted may be wasted due to stress. I think the patient should be prescribed a sedative herbal syrup like passiflora for a while after penile augmentation. Antidepressants may also be prescribed to such patients whose urinary incontinence lasts for 1 or 2 months. Secondly, there are also drugs that relieve the contraction of the bladder. These drugs may also be prescribed. Since the source of the problem is the contraction of the bladder, drugs that relax the bladder should be prescribed. And then, the patient may also benefit from physical therapy. In physical therapy, they prescribe exercises strengthening the muscles at the exit of the bladder that help stop the urine. There are, in fact, physical therapy devices that directly stimulate those muscles. You connect the electrodes, it makes the muscles work. In other words, the purpose of physical therapy is to strengthen the urinary retention function. If the problem lasts for 1 or 2 months, I think this is a must, because this will help the patient recover. Well, as I've said, I've seen only one patient with long-term distress of this sort. The patient needed physical therapy. I had to prescribe antidepressants. Of course, if possible, we recommend the patient to reduce the stress in his life. Otherwise, only one former patient told me about this problem when he came for his check. He said that urinary incontinence lasted for 1.5 months after surgery but then disappeared by itself. So it lasted quite long, but then disappeared by itself. Interesting. He hadn't told me at first. So it's a remarkable subject. I used to say that there was nothing that I didn't know about the surgery, but still, every day, I continue to learn something new. Now, I have learned that if the patient is going through a very stressful period, it may not be the right time to do this surgery. For example, if there is a challenge such as a university exam before the patient, it may be less problematic to do this surgery after the exam. Urinary incontinence is a rare occurrence, nor is it something we see in many patients, but I think it would be better to perform this specific surgery in a stress-free period. Yes, it is an interesting subject. Let me just think if there is anything else I can add to this. I guess not. Well, as I've said, contact your doctor if you experience urinary incontinence. If you are my patient, please let me know. I will prescribe you a medication, maybe a bladder relaxant, plus a sedative syrup or an antidepressant. You will certainly feel much better. Because I've heard one patient saying that he did not experience urinary incontinence after consuming alcohol. He had no urinary incontinence when he drank some alcohol. Actually, it makes a lot of sense, because first of all, alcohol relieves the stress. Second, alcohol probably relaxes the bladder as well. The contraction is alleviated. Therefore, urinary incontinence is also reduced due to this mechanism. It's a quite interesting issue. There are patients who have questions about this. There may be patients over the internet who indicate that they had urinary incontinence. I think it all boils down to stress. Just as some patients get ulcer due to stress, other patients may have urinary incontinence due to bladder contraction. Anyway, I think we've resolved this issue, we've finally clarified it. If I encounter such a problem again, at least I know what the reason is now, because I had all the tests done. On that patient, we applied the appropriate treatment to resolve the issue, and we finally treated him. So I think the issue is clear. It is caused by stress. Okay, thank you for watching. Hope to see you in other videos.